Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale and Paradise Valley area since 1992, and I just perform cosmetic or aesthetic surgery. I do all sorts of plastic surgery all over the body, and one of the more common things that I do are breast implants or breast augmentation. A very common question that people ask are whether it be saline or silicone implants. How long are my breast implants going to last? How long will it be before I have to address them again in terms of possibly having them exchanged? And I want to go back to 1992 or so, and before that. That is when the silicone crisis was, if you will, and there really was no cause and effect relationship between silicone and any disease. From that time, we used saline for a while until the silicone came back on the market about 7, 8 years ago. Prior to that, implants were put in, mostly silicone, back in the 60s and 70s, and we found that throughout the 60s, 70s, and 80s and into the 90s, that we started to see at the end of the 90s that implants started to degrade a little bit. So as a rule, we feel that the newer implants are going to last longer. But if you ask your plastic surgeon, generally implants need to be exchanged, or you need to think about exchanging them anywhere between 10 and 20 years. And basically, the rule that I tell people is somewhere around 10 or 15 years, I think that you should start thinking about exchanging your silicone implants. We do know that they last longer now, again, because the outer pocket of the silicone implant is thicker and tends less to have problems with any migration of silicone. The saline implants are easy because if you have a leak, generally you get a flat tire, so all of a sudden the breast will deflate. But there are other ways of telling. On a breast exam, you can see if the breasts seem to change at all. If you feel that they become hard or somehow become different, you should see your plastic surgeon. With the newer implants, also there have been some recommendations about MRIs to be done periodically, and there really is no steadfast rule about when an MRI or a mammogram needs to be done, and that's something that probably you should talk to your plastic surgeon about. But I think that if in fact you're not having problems with your implants, you don't feel that you need to have any change in your breasts at all, maybe having a lift or something over time, you generally don't have to address them at least for 10 or 15 years. So if there's ever any question, you need to talk to your plastic surgeon about it and make an appointment. Thank you.